Hello and welcome back to my channel. Today I'll be talking to you all about Addison's disease. Addison's disease is a disease where the adrenal cortex does not produce enough cortisol and aldosterone. Cortisol is a hormone that is released when we're in some kind of stressful event. For example, if you were driving down the road and someone all of a sudden just cuts you off, cortisol would probably be released at that point because of the fear and anxiety, as also the anger that you will be feeling if someone cut you off. What cortisol generally does is it heals those inflamed areas so that you won't stay inflamed. Cortisol also regulates the heart rate, the blood pressure, the blood glucose, and the immune system. Aldosterone is a hormone that's released in order to regulate the sodium-potassium channels at the cellular level. People that are diagnosed with Addison's disease generally have some form of HIV or AIDS-related infections, tuberculosis, some form of major fungal infection, a congenital defect to the adrenal gland, cancer to the adrenal gland, surgery to the adrenal gland, and also some form of trauma to the adrenal gland. The symptoms are quite severe in that they generally lead them to some form of hospitalization. And these symptoms are as follows. The symptoms are loss of consciousness, fatigue, low blood pressure, low heart rate, low blood sugar, dizziness, diarrhea, depression, orthostatic hypotension, which is when the person is coming from the lying to standing position, their blood pressure drops, joint pain, nausea, sensitivity to cold, abnormal menstrual periods, abdominal pain, and extreme acne. So generally, a person that has an autoimmune disease has some form of exacerbation within their time period. And usually they're hospitalized for several days. I remember when I was battling with lupus, several days, weeks. I think my longest time was every other month, 5 times that year. And that was in 2018. So yeah, I was really sick at that point. But however, someone with an Addison's disease diagnosis doesn't just have an exacerbation. They have a crisis. And that's because several organ systems are involved. Their heart is involved, their liver is involved, their adrenal glands are involved, their kidneys are involved. Everything is pretty much involved, for the most part. So they are in the hospital for pretty much weeks if they don't get their levels up, as far as cortisol and aldosterone is concerned. Their crisis symptoms are as follows: extreme fatigue, loss of consciousness due to a low blood pressure, low heart rate, and blood glucose, severe vomiting and diarrhea, high fever, sudden deep pain in the lower back, abdomen, and legs, and extreme joint pain. The endocrinologists and the rheumatologists use blood tests in order to check for the sodium and potassium levels in relation to the aldosterone hormone. Also, they use the blood testing to determine cortisol and adrenocorticotropic hormone levels in order to determine the cortisol levels. They use the x-rays to determine if there is any inflammatory joint issues going on in that person's body. And they also use the CAT scan to determine whether the adrenal cortex is damaged or the adrenal gland. So as far as their advice goes, they feel, and I'm actually referring to the endocrinologists and the rheumatologists, that anyone that is diagnosed with Addison's disease needs to stay on their medications. And the reason why is because their symptoms are so life-threatening. And their exacerbations/crisis periods are very life-threatening. So they really feel like they should stay on their meds in order to have a longer life. They also believe that they should wear a medical bracelet, so that if they're found unconscious in the middle of the road or out in the parking lot, the EMS workers will know what to do for them, as well as know who to give them to when they arrive at the hospital. So many patients go to the hospital, through the emergency room, and they are just placed in general population. No one knows what they have. No one knows how to treat them. No one knows who their doctor is. And because of that is because they don't have a medical bracelet to indicate what they have. So they end up sometimes dying in the emergency room because no one really knows how to effectively treat them. So the medical bracelet is a good call because at least if you're in critical condition, they will know what you have and what to do for you, instead of just placing you in general population wondering what to do. So I believe that's a plus. So at this point, I have questions that you should ask your doctor because you should always communicate with your doctor. I don't care who they are, just communicate with your doctor. Your endocrinologist, your cardiologist, your rheumatologist, communicate with your doctor. Don't communicate and just give me my pills and let me go. Communicate with your doctor, please. It's so important because this is how you connect with your doctor. This is how they know where you are as far as your mentality goes in relation to remission. They need to know that, because otherwise you're just going to get your pills and go. That's it. And you're not going to be pivoting to a remission lane because you're one of those that just give me my pills. Dr. Mack, just give me my pills. Okay? So we don't want you to think this way. We want you to have a better mindset and also approach in order to your doctor, so that you will have a good communication level with your doctor, because that's too important. Especially with someone with Addison's disease. Number one, you should ask your doctor, is there any recent research regarding Addison's disease? So it's just really so important, to ask this question, because you need to be abreast on the knowledge that's being received by the doctors so that you'll know what to do in the future. Right now you may have just a base level of the knowledge, but there's so much information being poured into the doctors now because of the clinical trials that are being done right now. And there are also some that are getting ready to start, and they need participants. So by all means, if you are interested in clinical trials, just sign up for one. And they also pay you a little stipend as well, just for participating. As long as you feel comfortable with the clinical trial, however. Don't just go into a clinical trial just because they're going to give you $200. Or you're going to be flown to Vegas, or you're going to be given $1,000 at the end of the month. Things like that. Join the clinical trial because you feel strongly about that clinical trial and you feel comfortable with the parameters of the clinical trial. Also, it helps you to get and prepare to pivot to remission. Because some of those actual clinical trials, they produce information regarding treatment types and also give you opportunities to receive information regarding what treatments are offered in other places. Some are offered in New Zealand, some may be offered in your state, some may be offered, in California or something like that. If you don't live in California, you just want to take a trip, you can take a trip, go and get yourself signed up for treatments that could help you to pivot into remission. Because not all the time does people have the issue with going into remission because they're on too many medications and no one knows what they're talking about. Sometimes some people go into remission because of the new medication. So, although that's a small population, it does exist. So don't be discouraged. Learn as much as you can about clinical trials, new research, because it's out there, and you should be abreast of that so that you'll have the ammunition to pivot to remission as well. Number 2, what nutrition and lifestyle changes should I make? So you should always ask your doctor this, because your doctor has your labs with he or she. They're the ones that run the metabolic panels. They're the ones that run the adrenocorticotropic hormone stimulation test. They look at everything. And as far as also if they're using x-rays or CAT scans, they know what's there. So you should be proactive in asking your doctor, should I add more calcium to my diet? Should I add more vitamin D to my diet? Should I add more protein to my diet? Things like that. You should be talking to your doctor about that. That's very important, especially if you're going through some kind of joint pain, or inflammatory joint problem. And also if you're really low in protein based on the blood tests. Also, if you have some form of damage to your adrenal cortex or adrenal gland, you need to ask your doctor about what nutrition you should add to your diet. Also, with lifestyle changes, you need to ask your doctor if you should be exercising more and what kind of exercise. I've learned that anyone with Addison's disease shouldn't just be doing exercise. There's certain exercises that they should be performing, and sometimes, with the exercises that we generally receive from a coach, from our past, or from a personal trainer, may not be germane to what you're going through. It'll actually help to inflame you more. So that's why you need to ask your doctor about exercises that you should perform as well, or if you should be meditating, or if you should even pick up yoga as well in order to help you to be more balanced. Because a balanced body is a body that's able to pivot when a problem arises. And if you're not balanced, then you're not going to be able to pivot to remission like you would want to. And this goes for people that have been in Addison's disease row for over a year. Chances are you're going to need to get some kind of nutrition or lifestyle change advice so that you could be able to pivot to remission. With someone that is balanced, they're able to fight the disease more. And this is more effectively, instead of just barely scratching the surface. They're able to fight because of the immune system's ability to basically to fight off that or ward off the inflammation that comes up when we're in those stressful events. When we're in those cases of surgery as well, which is also when cortisol is released. So a person that's balanced is really able to thrive a little bit better and also fight more effectively as far as any disease is concerned or any infection. Number 3, are there any support groups for Addison's disease? So you need some form of support group, because if you don't, then you'll be more fatigued, which leads to a lot of depression, which is one of the symptoms of Addison's disease. And it's very important to have people in your corner to kind of lift you up and give you hope, because it actually helps, with your mindset. It helps you to go do things that are going to help you to pivot to remission. Now, if you have some people in your corner that are like, hooray, go girl, go boy, you can do this. Don't worry about anything. I know God can help you. You're going to go into remission so quick. You're going to wake up in remission, baby. If you have people like that in your life, whether it be your family members, your friends, or your colleagues, or anyone you work with, then that's fine. That's great. That is your support group. That's awesome. However, if you don't have that in your life and you have the opposite, then you need a support group. For example, if you have people in your life that are just Debbie Downers, don't want to see you achieve anything positive, want to keep you down because they have a problem, you need a support group. If you have family members that they love you dearly, and I have them, they love you, but they tend to say things that are negative as well. I mean, for example, well, I'm still fighting lupus and I'm trying to get into remission, and I'm taking this supplement. Oh, baby, you don't need to take that supplement. I mean, baby, Aunt Glory, she couldn't get into remission, and if she can't get into remission, you sure can't. If you got people like that in your family, don't hate them. They don't know. They really don't understand what you're going through. And you just have to pray for them, really. I mean, and that's really something that you should practice when you're facing that on a daily basis or a monthly basis or every holiday. And in those cases, you do need a support group. And a support group is not, not like the thoughts of the AA support groups where they basically have you in this room and you're just like, did not say nothing. I don't know who this person is. And you have the leader saying, oh, we have a new person. Please state your name. And you're like, do I really want to state my name? And you get up and you put your shoulders back. You're like, my name is Jennifer Mackey, and I am new to AA, and I want to kick the alcohol habit. And everyone says, hi, Jennifer. It's not kind of like that. It's more of, you do have to introduce yourself because the leader has to ask you to do that. But everyone in there is there to support you. And you should be willing to support them too. For example, if someone was able to overcome the extreme acne or the joint pain that people with Addison's disease experiences and you are not, you could talk to those people and they could actually give you the tips that they have actually learned. And vice versa. If you were able to overcome the fatigue and they were not, then you could share your testimony regarding how you were able to overcome fatigue. So that's how that works. So, I mean, in that particular case scenario, you have to, just be open. Don't think about it as if it's just you're the problem and that's why you have to go into a support group, because you don't have a problem. You just need to talk out how you feel. You need to share your testimony. You need to be able to help somebody else in that room too, and vice versa. They're going to be able to help you also if you're open. Number 4, could you refer me to a psychiatrist? So this is for people that are very shy and really are not very comfortable with sharing their information with people, or people that just really don't want to share their information with people because they've had past experiences that kind of added the stress to them, and that's why they have Addison's disease. So in that particular case scenario, you need to ask your doctor for a psychiatric referral. And this is going to help you to unload or offload whatever is bothering you. And as far as the disease is concerned, whatever is really keeping you from pivoting to remission as well. Now, I need to tell you this because I've heard it from 2 patients, and I've also had a side-eye experience with a patient as well. And I just have to give you this information because I know you're gonna be like, what? Okay, so basically it wasn't an issue, it was a situation with a patient where I told him that because you have anxiety, you need to see the psychotherapist, and I'm going to refer you to a psychotherapist because you need to see the psychotherapist. I mean, it's very important for you to kind of offload what you're going through so you can get used to the road again. And he went to the front and he said, you know, Dr. Mackey's going to send me to that crazy doctor. And I was, and it took me aback because I was, what? No, the psychiatric doctor or the psychiatrist is not a crazy doctor. You're not crazy. This is a doctor that's going to allow you to unload and offload all the stress that you're going through as far as this disease is concerned. So please don't think that this is a crazy doctor. She's just going to just judge me, and I mean, it's going to just be so awful. And why should I go to this crazy? I'm not crazy. Yes, you're not crazy, baby. You're not crazy. And that is why you need a referral, because you need to unload these things or you will become crazy. That's what generally happens. So because depression is one of the symptoms of Addison's disease, it's very, very, very important that you either take the support group option or the psychiatric option, because otherwise, I'm sorry, I mean, but you can become loony for real. And it's not something that I'm sure your family and your friends that care about you want to see you endure. Okay? Number 5, if your doctor was unable to answer your questions regarding nutrition or lifestyle changes, you should do the following. You should ask your doctor the following. Could you refer me to an alternative medical doctor? So an alternative medical doctor could be a nutritionist, a naturopath, a chiropractor with a nutritionist or functional medical background, just a functional medical doctor. It could be a doctor with all of the above, actually. And this doctor will be able to help you to get to that balance point. This doctor will be able to give you what nutrition changes you need to make, as well as what lifestyle changes you need to make. They'll be able to let you know about protein and vitamins and other supplements as well. And if you need to, join a yoga team or join a gym that actually provides a personal trainer that will be able to help you with the exercises they're going to give you to perform in order for you to have less joint pain, and also to work through the joint pain as well. So they're very important. And if they don't have anyone to refer you to, go online and check on the reviews of the nutritionists or the functional medical doctors or chiropractors with functional medical or nutritionist background, or someone that has all the above or a little bit of both of those, or of one or two of those particular positions, so that you can get the help that you need. Because in order for you to really effectively fight this disease, you really do need to be at a balanced body status. And at that point, you'll be able to fight anything in your path. So I'm glad you watched this video, and I'm really thrilled about the future videos that I'm able to share with you guys. Please like and subscribe and click the notification bell so that you can receive all the videos that I'll be uploading very soon. And share this video with anyone you know that has Addison's disease or any autoimmune disease. So that they will be able to get encouraged, because that's really the reason why I'm doing this. I battle an autoimmune disease called lupus, and I'm telling you, I'm a living witness. God can help you through anything, and He will, and will help you if you just call on Him, and if you just basically just ask Him questions of what you should do. And also watch videos like this one, because this is going to really help you to pivot to remission. Really, if you just stay with no information, I'm telling you, you're going to stay with that disease, and you could die with that disease. And I should know this as well, because my mom, because she did not have the information that she needed to fight the MS, she died from MS. So please, by all means, share this video, like and subscribe, and click the notification bell. And as always, thank you very much for watching, and I look forward to serving you in the next video.